𝗪𝗡𝗙 and welcome. I'm 𝗨𝗡𝗙𝗪. Today we are honored to be joined by Ms. 𝗪𝗡𝗙, the Country Director for Bhutan at the United Nations Population Fund or UNFPA. Based in New Delhi, she is currently in Bhutan for a visit. UNFPA collaborates closely with Bhutan to advance reproductive health, gender equality, and youth empowerment. In this interview, we will explore UNFPA's impact, ongoing initiatives, and future plans for Bhutan. Stay with us for this insightful conversation. Now over to you, Ms. Andre. Welcome to Bhutan, and thank you so much for joining us today.
Thank you so much.
Yes. Now, to kickstart, Bhutan became a member of UNFPA in the 1970s, and I believe the first country program started in 1988. So how has the partnership between UNFPA and the Royal Government of Bhutan evolved over the years, especially in the context of changing demographic and social challenges?
Okay, thank you so much. It's always a delight to be here in Bhutan. I'm based in Delhi and I come frequently to work with the team here. And because Bhutan is so committed to what we call the International Conference on Population and Development. And that was a famous conference that took place in 1994. So 20 years after, Bhutan had already started working with UNFPA. But that conference was really about changing how the world sees population, not as numbers, but as human beings who have potential that needs to be developed to preserve dignity and for us to blossom and live as full-fledged humans. But if I roll back to our partnership that began in the 70s, it really began with a program on family planning, as did the work of UNFPA in many countries in the 70s. Including India, by the way, which started even earlier. At that time, you might not remember, you're a bit young, but the world was worried about population explosions. And the world was worried, countries were worried about being able to respond to the needs of their populations, whether it was food, whether it was sanitation, whether it was education, whether it was health. And so many countries initiated family planning programs. So that was our very first program. With Bhutan.
Now, Ms. Andre, you said it wasn't, back then it wasn't focused on numbers. But now, talking about numbers, UNFPA started its program, like you said, in Bhutan by formally integrating family planning into the healthcare system. So in 70s. So in fact, a lot of programs from 70s to 80s were on family planning. So Bhutan then was following this principle called, small family, happy family policy. And now looking at the current trend, Bhutan's total fertility rate has decreased, has fallen below replacement level. We have two sources, like from the national survey, it's 2%. From the NSP from 2017, our fertility rate has dropped to 1.7. So now, what were the key factors that led to the integration of family planning into Bhutan's primary healthcare system first? And what are the crucial factors to consider in developing policies or interventions to address this trend now and ensure a balanced and sustainable future?
So first I want to say what Bhutan is experiencing is not out of the ordinary. There are many countries in Asia who have also experienced a rapid decline in fertility rates, and many countries around the world. But it's not a sign for panic. Really, it's a sign of an achievement for humanity, because let's look at the population structure. Why does fertility decline? There are several reasons. One of them is populations begin to age, right? And it's because life expectancy is increasing. So you have people living longer. You have people also living healthier lives. So that's already an achievement for humanity. People are not dying of all those vicious diseases that they were before and living very short lives. So when you introduce family planning, it gives women and couples the opportunity to choose when, if, with whom, and how many children they would like to have, which can correspond then to the individual's means, to support that child, and also the country's means to provide services, whether it's in education or health, or available jobs. So these are some of the factors that will influence. But if we look at Bhutan's education system, Bhutan has had a very strong education system, and it has a very highly educated population, almost 100%, almost universal education. It has a very highly educated English-speaking population, which is very sought after by many other countries. So that has also led to changes in the way that women and couples see the need for large families. It's one thing when you're living on a farm and you need a lot of hands to pick crops. It's another when you're working using your mind and your educated brain to perform a service or a task. And so that also has a big impact on people's desire for smaller family sizes. The other is, of course, as life becomes more expensive, economies grow, they modernize, it becomes more expensive to have more children. So families are taking the decision that instead of having many children that they can't feed properly, they can't educate properly, they prefer to have smaller numbers that they can see through to their full human potential, if I can say it that way. And then finally, there's the worldwide scenario, and it's not unique to Bhutan, of an inequality in the household. So the fact of the matter is, here in Bhutan, you actually have more women going to university. And we see that trend in many countries. But what we don't see in many countries is men taking on a greater share of the household labor. I'm not saying it's not happening, it does, it is. And many, many men have come along, but it's far from the norm. It's far from the norm in other countries, and it's far from the norm in Bhutan. So when women are given choices and options, they choose to prioritize their own development and their own contributions to society through work and education, as opposed to as householders.
UNFPA has contributed a lot in reproductive health, in family planning, in a lot of other areas. So now, how has Bhutan's approach to reproductive health changed over the decades? How have you seen it changing over the times?
Okay. There are some really great examples and statistics here in Bhutan. First of all, maternal mortality has greatly reduced. Mm-hmm. It's now down to 53 per 100,000 women giving birth. That's way below the Sustainable Development Goal target. It's not great because, of course, even one preventable maternal death is too many, but already 53 is a very good number. And Bhutan has really declined several 100% each time it goes to measure that. So it's doing very, very well. And we are working with government now to try to figure out where are those last remaining maternal deaths occurring and why. That's what we need to find out. And it's really what we call the last mile, looking at the data, looking at where it's happening and why, and trying to then set up systems and procedures to prevent that from happening. So that's a very positive example for Bhutan. Another is Bhutan's ability to manage HIV and sexually transmitted diseases. Bhutan was very open. And thanks, I have to say, to Her Majesty, 𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪. She has been an indomitable force, and she has gone from low to high and back again, and from left to right and across to really spread the word. And she's been doing that for over 25 years. And we really can't, we can't even put a qualifier on how much that has done, because there are very few countries that have that kind of backing like that over 2.5 decades. And her voice has been so important in influencing people to change their norms, to understand how to be healthy, and to seek services. So Bhutan has done very well in managing its HIV and sexually transmitted diseases. And if I give the specific case of HPV, Bhutan has done a fabulous job on human papillomavirus vaccine. And it has also vaccinated not just girls, but boys, because boys can be transmitters and they can also end up as cancer victims because of HPV. But most countries don't vaccinate boys. They don't go to that trouble. But Bhutan has, and it's done an amazing job. So that's very, very commendable. Bhutan has done a really good job on meeting unmet need for family planning. There's still a little bit of work to do, and that's really linked at the lower levels of the population, the younger girls, the under 19, like the 15 to 19-year-olds, where we're seeing teen pregnancies still happening. But otherwise, it's done well on unmet need. And it has introduced new contraceptives that are more, that give women and couples more choice. The long-acting ones that allow them to pursue education and to pursue careers that other methods maybe would not be so appropriate for.
Right. So it's really nice to hear that Bhutan has improved a lot in some area. But now talking about an area which is again taken care of by UNFPA is gender-based violence. And gender-based violence remains a significant, it's a very significant issue in Bhutan, with studies showing that 2 in 5 ever partnered women have experienced some form of violence in their lifetime. So what specific actions is UNFPA taking in partnership with the government and the civil society organization to tackle this issue?
A lot of people don't even know what gender-based violence means. We could maybe say violence against women as a short way of saying it, but it doesn't always mean just women. It's sexual violence against all people. But when we talk about gender-based violence, it's a complex issue, and it requires a multi-sectoral response. So we've worked with the government and civil society and academia on many different facets. The first is on a framework for the elimination of gender-based violence, which was launched today. And that framework really sets about how the government and partners can work across the various sectors. So first you have always services to respond to gender-based violence, and making sure those services are friendly, that they don't stigmatize women, that they don't blame women, that they don't accuse them of being the ones who caused the problem. The next is making sure they're confidential and making sure they're available in all places. The next is making sure there's psychosocial support, because of course it's extremely traumatic, and it's usually not a one-off affair. It's usually something that continues. The next is making sure there's police support, and that police are well sensitized to a survivor-centered approach, which means you always take into account the person who has undergone that trauma and try not to re-traumatize them while you're giving them that police support. And then the final is juridical in the courts. If it ever goes to that stage, making sure that all are well briefed on the laws, that they understand what the laws are, and that the woman is given proper support to take her case through if she desires. So once again, Her Majesty has been an amazing force, not just on sexual and reproductive health, but also on the elimination of gender-based violence. And she has advocated far and wide on why this needs to change. We've also worked with civil society organizations, with her NGO, Renew, who has been extremely active in setting up community service centers and making sure that there are resources available across the country. We conducted a study last year on social norms assessment here in Bhutan. And it's always important to do that because norms can differ from place to place. And the violence can be caused by different reasons. In some places, it's because there's a desire to protect honor of the family. And so women are treated in a particular way if they're perceived to dishonor the family. In some places, it's just linked to economics. Other places, it's linked to alcohol abuse. There are many different reasons. In some cases, it's urbanization. In other cases, it's a rural phenomenon, or both. So we undertook this assessment and will be unlocking and really unraveling what the content of that assessment to try to understand where are the best entry points and where government resources need to be most invested for preventing and responding to. We also work, and we haven't yet talked about it, but one of our big programs here is the life skills education and comprehensive sexuality education. And please allow me to clarify. We don't say comprehensive sex education. We don't teach sex to anybody. Right. We teach sexuality, human sexuality, which is a naturally occurring phenomenon. And we have hormones, we have bodies, we have physical reactions, that's what we teach. We don't teach sex. So through these programs, we start to change mindsets. And we start to work on critical thinking and helping people understand that they have rights based on your constitution and that they're entitled to those rights. We also work on attitudes. We work with young girls and boys on what does it mean to be positively masculine? What does it mean to be toxic masculine? And what does it mean to be an empowered woman? And what does it mean to not assume one's rights? So these are some of the ways we work across different sectors, prevention, services, and most of all, attitudes.
Right. Now, recently talking about the life skills, 3-4 days back, UNFPA in partnership with the Central Monastic Body also launched the life skill curriculum in the monastic schools. So what's the main objective? Of course, you said why it has been introduced to young boys and girls in schools. Now, why particularly specific to Central Monastic Body?
UNFPA works in many countries with religious leaders because they're very influential. And who do we listen to in life? We listen to our parents usually, we listen to our teachers, we listen to our religious leaders, we listen to our king or to our government leaders. Here, that was a missing piece, was working through the monastics because they have such an influence and people respect them so much. So we worked, it started already more than 20 years ago, these discussions, but really bringing the course into the curriculum has just come about now. And it was through, frankly, the far-sightedness of the monastics. They see that there's a need there. They see a changing world. They see the importance of those children, girls and boys, having those critical thinking skills. And so that's why we approached them, and that's why we wanted to help support them to introduce this into their curriculum.
Now, Ms. Andre, earlier you spoke about how Bhutan, like any other countries, is facing this challenge of having more aging population. In fact, Bhutan's elderly population is expected to reach 14% of the population. And then we have lesser and lesser working age population. So now, what challenges should Bhutan prepare for, and how can UNFPA assist in addressing the needs of an aging population?
Okay. Yes, it's true. Bhutan's population will reach 14%. I think it's 2053. So there's a little bit of time at least a generation, and good that Bhutan's thinking about it. Because what happens is, as we know, without proper social protection systems and pension systems, elderly people become very vulnerable and they're very dependent. So the idea is to assist countries to make sure that they're planning for that eventuality, so that that older population is not dependent, just like the younger non-working age population is very dependent. And so when you have a huge youth population that's not working, if your population's like a pyramid, that's very heavy to support on the bottom and on the top when you have a small working age population. So the idea is to make sure you're already planning for those populations. So we worked with the government on the senior citizens policy 2 years ago. And now we're working with the government to do what's called national transfer accounting. And what that does is look at the country's needs and resources and expenditures across time and across generations as a population is changing. So the reality is you have a smaller aging population now, so the needs of that population are small in comparison. But as they start to grow, and as the working population stabilizes and may eventually even decrease a bit, how will they be able to support the rising, that large youth population will grow old and then become the elderly population. So how to support them? And what we try to do with governments is talk about a life cycle or a life course approach, whereby we go from cradle to grave. What are the best investments a government can make to make sure that that baby is born healthy? And that starts with prenatal care and good treatment of the mother during the pregnancy. That starts with a healthy delivery. That continues with a healthy childhood, with vaccinations, with nutrition. Then you go into adolescence. And that's why we insert the comprehensive sexuality education at that time, although we actually do it even earlier here in Bhutan, to make sure that young people understand how to protect their bodies and how to take care of their bodies and their minds so that they can move into the next phases of their lives. Because an adolescent who only eats chips and chocolate and drinks Coca-Cola is not going to be a healthy adult. And that unhealthy adult will then be a burden on the Bhutanese medical system when they contract diabetes and high blood pressure and cholesterol problems. So you see, it really has to start from before the womb and carry on all the way through. So we're looking at where the best investments can be made with a government's limited resources and how they can get the most bang for their neutrum in keeping the population healthy, living a dignified life, and also have savings to live off of.
Now, Ms. Andre, lastly but not the least, looking ahead, what are some of the other areas beside what you just spoke about? What are new and emerging issues that you see shaping future collaboration between UNFPA and the Bhutanese government? And how can both the parties work together to address these challenges effectively?
There are a couple of things in general that not just Bhutan, but all countries are facing, and that is the digital divide and making sure that girls and boys have the same access, because we all know that the future is digital, and making sure that elderly have access to digital, because we all know that that will become the way of them receiving a lot of information and services, and even keeping them from being isolated, which is a huge issue. The next will be on gender-based violence online. Online bullying and harassment is a huge problem, and very unfortunately it's growing across the world. As you know, with fake news, it's your business, it's what you do. As you know, with algorithms and how it impacts what we see on our screens, we have to be very, very vigilant about what especially young men and young boys are being fed online, because we see a very disturbing trend of misogynistic, anti-woman postings and trying to influence those men into very harmful behaviors and attitudes. So that's something that we'll be working on. We'll be looking at innovations. How can we reach the furthest behind populations, whether it's persons with diverse sexuality orientations, whether it's rural populations, whether it's persons with disability. And we've already worked on the disability policy with the government, how to make sure we're reaching them through innovations, whether they're tech or alternative means of meeting their needs. Because of course, all those populations I just mentioned are between 6 and 10 times more vulnerable to abuse.
Right, right. So again, that brings us to the end of our conversation. We sincerely thank you, Ms. Andre, for sharing us your insights. And as the country continues its journey toward improved reproductive health, gender equality, youth empowerment, and areas you spoke about right now, collaborations like these play a crucial role in shaping a better future. So thank you so much again.
Tashi Dilek, thank you so much, and we will be together for as long as Bhutan has needs.
Thank you.
Thank you.